Good morning, home health heroes. This is Amy Register sitting behind the computer with your beloved home health mentor, Teresa Register. Mama, you were telling me about value-based purchasing and how it can really benefit some high-performing agencies, and how if people are low performing in their agencies, they're going to want to check some stuff. But you've got some history on how this whole thing came about. Why don't you get us started telling us a little bit about what's going on?
Yeah, good morning. So value-based purchasing, or the concept of value-based purchasing, isn't new, but there are some things that are going to be changing in January of 2022. So I thought it would be good maybe for agencies that are not familiar with it, who haven't been one of the agencies that have been in the program already. I thought it might be helpful to go over some of the basics. And then maybe, for the next two sessions, we might talk about some of the details a little closer at it.
Okay.
But today I just wanted to kind of introduce the topic and give a little background and give some ideas on some things agency owners and administrators might want to look at.
Excellent. Yes.
Sorry, I'm getting a cold, so I apologize for having to clear my throat. But so the phrase value-based purchasing is not necessarily familiar to everybody, especially if they're new to the home health industry. But the concept is really pretty simple. You probably have heard people say, you probably said it, you get what you pay for. And Medicare wants to only pay for high quality care, obviously not for substandard care. They want to pay more to the agencies that provide measurably higher quality care and less to agencies that provide poor care. And since the industry as a whole now has tools that we think pretty accurately measures what high and low quality care is, that provides the basis for Medicare to determine who they want to pay more to and who they want to pay less to for their home health services. So that's kind of the concept in a nutshell. So to give a little history and background, this payment model was rolled out in 2016 for 9 states, and it was rolled out on a trial basis to see whether or not what was predicted would actually happen. So in those states where it was rolled out, they saw an average of 4.6% improvement in quality scores. And the big difference and the big incentive for Medicare was that they saved $141 million. So obviously with
That's
those,
incredible.
yeah, especially with, that kind of response, they decided that obviously it needed to be rolled out nationally.
Yeah.
So,
Wow.
yeah, makes sense. So these changes will go into effect for all states as of January 1st, 2022. Between now and then, I would like to try to give some of the agencies that are less familiar with value-based purchasing a little bit more insight about some things that might affect their bottom line. Hopefully, they are already looking into this. It's like I said, it's not new information. Agencies have been on notice that this was coming. But I know the realities of running home health agencies, and I know that sometimes you don't really have a chance to focus on it until it becomes absolutely necessary. And I think we're
Mhm.
at that point now where it's absolutely necessary. If they haven't taken the time and done the work, it's time now for agency administrators to really drill down and look at their agencies real critically, um,
Mhm.
honestly, and looking at their data and really how their agency is functioning. So today, I wanted to review the basics, and one of those is how it's referred to. We're really good at just labeling things with a bunch of letters. And so this, like some of our other things in home health, this is called HHVBP, Home Health Value-Based Purchasing.
Yep.
So yeah, another
Lot of
another one.
letters.
Yeah. So sometimes it can get confusing. What are we talking about? So this is home health value-based purchasing. And this model will penalize poorly performing agencies. And the way it's calculated is as a percentage of what has been defined by Medicare as that agency's baseline reimbursement amount. So it's based on the starting point is based on what Medicare considers their baseline reimbursement amount, and that if you're a home health administrator, you know what that means.
Okay.
You know that there are adjustments to payments, and so whatever your baseline reimbursement amount is, that's going to be the starting point. So the money that doesn't go to poorly performing agencies will then fund the incentive payments for high performing agencies. So, on one hand, Medicare is saving money because if an agency is poorly performing, then that money that they're saving, theoretically at least, is going to go to the high performing agencies.
Right.
So it's pretty simple. Obviously, if Medicare is saving dollars, if they saved $141 million in those 9 states, it it kind of is a no-brainer that they're saving money. It's not like all of the money is going to go to the high-performing agencies.
Right, and it
So
sounds like a win it sounds like a win-win situation where, like, incentives are great. You're
yes,
gonna be driven to better care, and your patients are gonna get better care, and Medicare will save some money. Good for
right,
them.
right, and Medicare is, our tax dollars. So it's like you said, it's good to be efficient, I guess is the best way to say it, to provide the best quality care efficiently and effectively. So that was the goal of this. Um,
Yeah,
so
yeah. Hey, I just
so
wanna greet a couple of people who just hopped on. Thanks so much for
okay.
joining us, and Michelle, I think you say her name, Yablonowski, just jumped on and said happy Friday. So thank you guys for joining
Hi,
us. We're
Michelle.
having fun today. All right, back to you. Sorry, Mama.
That's okay. So there are some things that agencies that have a low basis for reimbursement. There's a few things that they will want to do and need to do to prepare for this. If they haven't already done so, they really have to look very carefully and critically at their agency's performance. What that means is look at your performance indicators, your quality indicators, how you compare with other agencies in your state and nationally to see if you are performing above average, average, or below average. And
Mhm.
then really look at what you can do to improve. And from having been on both sides of the coin, I've been I've been a worker and I've been a manager and I've been an administrator. And I can tell you that a lot of times there's a gap between what the administrators know and what their staff know about what's going on in the agency and what the problems are. So it's going to
Mhm.
be really important for administrators to seek and 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 try to um, draw out honest feedback from their staff. A lot of times, staff are concerned about speaking out, speaking, the truth about what's happening, because either there's a culture of criticism or finger pointing or that kind of a culture. And so staff are sometimes afraid to speak up. So it's going to be
Mhm.
really important for administrators to seek honest feedback from their employees. One way they can do that is to do, just some kind of a questionnaire that is, um, it's going to be um, pretty straightforward. They might have a suggestion box, something, some kind of system for their employees to be surveyed and asked, what can we do better? Uh,
Mhm.
Administrators have to model that kind of behavior. They have to be very open to feedback. And sometimes the culture is a big barrier to that kind of feedback. So look
Yeah,
honestly. Yeah, look honestly
that's rough.
at, yeah, nobody likes to be criticized, right? And everybody
And I know.
does their best. So, you know, we don't
Well,
want
if you're a home health administrator and your employee has forwarded this podcast to you, we're talking to you.
Uh, that's a that's an interesting thought. Um,
I
but
know,
yeah,
it's, like, so rude.
but yeah, it's really important for administrators, if they haven't got a culture of accepting input, then this is really important that they seek that kind of input, because like I said, sometimes there's a big gap between the communication between the field staff and administrators.
Yeah, this is
And
so rough, and something like this, where you basically have 3 things in every successful business. You've got a great product, great people, and great promotions. So,
yeah,
like, if the people and the communication side is lacking, that's, like, one huge chunk of your business, and if this is the kind of, like, sink or swim time, then, like, we've gotta get over our egos, kinda pull together as a team and just, like, ouch. Yeah, it's gonna hurt if we're not doing things well, but, like, do we wanna be in business next year?
yeah. Do we want to have a job next year? Do we want to have
Right.
an income? So this is critical. There will be agencies that go out of business over this, because the margins that agencies are reimbursed are so small that if these agencies lose an additional, up to 5% because of their low quality of care, then it's going to be, it's probably going to be curtains for them. They will
Man.
they will have to go out of business. Um, so you need to really honestly look at your agency and ways to improve. And one of the questions that I would like to ask administrators and managers and staff is, if you had to pay out of pocket for the care you're providing, would you think it's worth it?
Mm. Mhm.
I saw agencies providing excellent care, and I've seen agencies providing extremely poor care. And obviously, no one wants to pay for someone to just show up at their home and spend 15 minutes basically doing nothing and and then leave. um,
Mm.
or worse, not picking up on problems that have come up. So, yeah, it's really important that you ask yourself, are we providing good care? And the only way managers and administrators are going to have a good feel for that is if they at least occasionally go out and visit patients in the home. And I would even
Mhm.
suggest if you're a small enough agency that you're, as an administrator, you're kind of close to patient care, go out and observe some of your staff providing care, or call the patients and talk to them and get some direct feedback, because a lot of times you really don't know what's going on unless you're on the front line.
Olga Gao chimes in. She says, "Yeah, I thought about that last question yesterday." So people are definitely thinking that
Good.
kind of thing.
Hi, Olga. I've communicated with Olga in the past, and so we're old friends. Um, so if this is the level of care that was being provided to your mother or your child, or whomever, someone you care about, would you be satisfied with it? So you really need to ask yourself some of those hard questions. And
I think
then,
this is a good time to promote your emoji satisfaction survey that's on the website.
oh yeah,
Does that fit
yeah,
in here?
sure, yeah.
Okay,
um,
I'll put it in the
Agencies will
comments.
often have a third party organization that does their questionnaires, but there's nothing that says you can't do your own as well and get get that kind of feedback. and
Yeah.
and by the way, that can be edited, so any agency can change it and ask the kinds of questions they want. So yeah, thanks, Ames. That's a
Mhm.
good thought. So you do want to take a look at your culture, as I mentioned. A part of that culture, excuse me just a minute. So, a part of that culture is how committed you are as an administrator to training and education. I know for a fact that many agencies are struggling to find staff. And so it's like, okay, we just hired an RN on Monday and we've got her seeing patients on Tuesday, and no time for orientation. And then, very little follow up education. And that
Mhm.
right now would be really, uh, you know, not good.
Mhm.
um, you want to make sure that you are really orienting your staff, making sure that they know how to do an OASIS, because that's going to be the basis on which a lot of the determinations are made. Um, Also, you want to make sure that you document any problems, any complaints that come in, because that's a good indicator to you about the level of care that your
Mhm.
patients feel they're getting. So you want to make sure that you're an agency administrator that promotes problem solving, not finger pointing or
Mhm.
criticism. And
Yeah.
I've worked in agencies where it was easy to point to another department that they didn't do their job, or another nurse that didn't do their job, or a therapist who didn't communicate. Whether or not those complaints are valid is not the issue. The issue is, let's focus on fixing problems.
Yes, just like every relationship, we are all to blame in some way, but how can we move forward?
Right. We are all part of fixing the problem, so we can focus on that. So you want to figure out what your strengths and weaknesses are, and then as an administrator you have to take the responsibility for improving whatever is broken. You also want to make sure you know where you stand in the competitive market. Most of you already know your baseline year data, and so that's where you're going to start, and you're going to take a look at where you're doing well and where your quality care issues are or what you're doing well. So that's where you're going to start. And
Mhm.
as I mentioned, adjustments to your baseline are going to hit in 2024, and there will be a maximum of a plus or minus of 5%. And agencies that are providing what's considered to be poor quality care will be penalized
Wow.
based on their scores in comparison with one another. And again, the margins in home health are pretty tight. So agencies that perform poorly will probably be forced out of existence, sadly, but true. And then high
Mhm.
performing agencies will do well under this payment model. And that is obviously designed to improve quality and save Medicare dollars. It's assumed
Right.
then that as the high performing agencies are rewarded for excellence, uh, Medicare assumes that it will just continue to get better and better and better. So that's just a little bit about the basics of value-based purchasing. And as I mentioned, over the next couple sessions, I'd like to break that down a little bit more and explain exactly how that payment model will work. So
Yeah.
today's session's been a little shorter than usual, but I really did just want to give an introduction and get people started thinking about how they need to prepare for this coming in January.
Yeah, that's great. I'll be curious to see, over the next 5 years if that levels stuff out, if everybody gets their stuff together and makes it even more competitive field, or if people do drop off um, in great numbers.
Yeah,
Interesting.
I think some agencies will survive and improve, and some will find that it's too much for them. And I've
Mhm.
seen that in other years where there have been changes in the industry. This industry changes constantly. I was thinking back about when I started in the 80s, and I've just seen so much change in reimbursement and regulations. The care issues have not changed really,
Right,
um,
right.
but and we have seen probably more migration of sicker patients going home to home health than
Mm,
we used to have a long time ago.
mhm,
Um, and so there are more um, in many agencies. They have more specialty services than
right.
we used to have. But in fact, I was thinking about how our agency that I worked at in Utah started. They actually were delivering babies at home in the like 1940s and 50s. So
Hmm,
we're not doing that. As far as I know, we're not doing that. Um, but it has changed a lot over the years, and every year we've got new proposed rules and changes in regulations,
mhm,
and frankly, if an administrator is not focused on all of these changes, and if you don't have a good compliance program or a good QA person, it's really challenging. And so, for those of you that are out there trying to survive, I get it. It's tough. This is a
man.
this is not an easy business.
Wow. Yeah, I think about that pretty regularly. That's why we do greet you guys as home health heroes because thank you for doing what you do. It's a really interesting, from an outsider's perspective, you have to love routine if you're in home health because there's so many things you got to check off your list every day, but you can't settle into a routine either because next month there's going to be something different.
Yeah, and it's hard to be a jack of all trades. It's hard to be an administrator and a QA person and a compliance person and audit charts and make out schedules. I mean, it is a really a tough business. So yeah, hats off to those of you who are still struggling and hanging in there, and hopefully you'll find some of the information that we cover helpful.
Yeah. All right. So just in summary, what are your takeaways for this? What is something that you mentioned earlier, just to come back, circle back around? Here's what you got to
Well,
do now. Here's your homework.
yeah, your homework is, if you don't have a good communication tool, a good feedback process with your staff, get them together and really ask for honest feedback about things that they see that need to be improved on, and and really don't take it personally. Just
Right.
listen and try to address the things that you agree with, that you see might actually be things that you need to improve. And then, of course, always look at your data. I'll look at your data reports to see where your problems are in comparison with other agencies, and really focus on the ways you can improve that, and draw in those staff members that are movers and shakers, get
Mm-hmm.
them involved in how to fix some of the challenges. But
Engineering a solution.
do pay attention to these deadlines that are coming up, and do some reading, listen to some other kinds of detailed webcasts so that you are prepared. And then, as I said, I would like to spend a couple sessions in the future between now and then talking about some of the details and a little bit more specific suggestions.
All right. Well, that was a good one for today. We'll leave it there, and we hope to see you back next Friday, where we'll continue with this discussion and take any of your questions and comments that you send to Teresa. In the meantime, you can reach her, of course. Facebook is the easiest. It's the Home Health Mentor on Facebook. And in the meantime, I've also linked a home health agency satisfaction survey that you can start to poll your those you are servicing, and get some of their feedback if you want to do that internally as well. I'll link that in the comments. So we'll see you next week about the same time.